hello. I'm Dr. Klinghardt. I'm a medical doctor practicing in Seattle, in the greater Seattle area in Washington, at the Sophia Health Institute. We're a clinic with 6 doctors and a lot of supportive staff. And we're specializing in the treatment of chronic illness. Now that sounds like probably vague, but the number of people affected by chronic illness is dramatically increasing in the last 20 or 30 years, probably exponentially increasing. And the main complaint people come to us with is that they don't have the same amount of energy, the same amount of zest, the same amount of passion for life, for living, or the same endurance that they once had. Not explained by their age. We have more and more young people, children, teenagers, that suffer from the same complex of symptoms. And so we're treating people in the office with therapies that are quite well known, and many people are also using intravenous therapies, intravenous nutritional compounds. We focus a bit on the treatment of infections. We clean up people's homes of mold and electrosmog. We attend to the psychological needs of our patients. And when people move through my office, they usually do several things in one day. Some of them may involve injections. I do neural therapy, trigger point injections. We use acupuncture. And some of the treatments are actually traumatic in the moment when you do them. And the patient sort of has to put themselves together in the hours following treatments, where hopefully they're landing on a higher level than when they entered the office. And in the course of the modalities that we put the patient through, we started using in November last year, this is now 5 or 6 months ago, the Tesla energy lights. These are lights created by Nikola Tesla. It's an idea that he created. These are lights that use different phenomena in physics. But the main thing needs to be understood. It creates a field that is positively charging the patient's energy field. And the amazing observation is that everybody who lies on the table exposed to these lights not only experiences afterwards a clear uplifting of their subjective experience of energy, but also the treatments that the patient had just experienced seem to hold faster, better, and deeper. And one of the applications for me personally is that between patients, I'm often, when people discharge a lot of their energy, they may be crying, they may be angry, they may be in a lot of pain. And after 2 or 3 patient visits, I get affected. I get exhausted, I get fatigued, my energy goes down, and I can go in our room with the Tesla lights and lie down for 5 minutes and be fresh again, which is an incredible discovery for me personally, that I actually can go through my day, do a heavy workload, and be good at the end of the day. It's a phenomenal tool. It's simple. There's only an on switch. It's not something where you have to choose from a million frequencies and a million modalities. You don't have to strap the patient onto some complicated instrument of, like EEG electrodes or EMG needles. The patient simply has to lie down, you turn the on switch, and the instrument is delivering the goodies to the field of the patient. We've never had a patient who had a negative experience with it. It means everybody comes out after 5 minutes or 10 minutes feeling better than before. And so it's become a firm part of what we do in the office. The Tesla energy lights are now used pretty much by all our staff members in between patients and at the end of the day. And the comments that we hear are simply those that a physician who's been completely destroyed by the encounter with a difficult patient can lie down on the table, switch the Tesla energy lights on. So the comments we hear from our clients are along the same lines, that patients that were always moderately scared to come back to the office because they know I may do some trigger point injections on them, I may do a spinal manipulation that they're afraid of, that they feel slightly after the treatments, they feel slightly discombobulated, that's the best word I know for that. They lie under the lights and they get the full benefit of the full intended benefit of the treatment much earlier and to a much larger extent than they did before. So we have a good number of patients that, if I forget to mention it, request to lie under the Tesla energy lights right away after the treatment modality that they received. And people feel that the overall recovery is speeding up with it. Yeah, so Aaron, since you have the last name Goldhardt, and I'm Klinghardt, so from Klinghardt to Goldhardt, you're welcome to use this information or use these recordings to purposes, as long as the intent is to help people, help the world to move to a better place, to a higher plane, you're welcome to use all of this.
Thank you very much. I appreciate it, Dr. Klinghardt.
From Kling to Gold. Yeah, no. It's really, I mean everything,